Good afternoon, everyone. End of the week. For those of you still working, I hope you enjoy a lovely weekend. For those of you that have been sitting at home for lockdown, my husband remarked this morning that one day rolls into another. I said, well, maybe for you, but enjoy the weekend nonetheless. So, hello. And today we're going to do the second part of the canine stifle, what we also refer to as the knee. So yesterday we looked at medial patella luxations, and today we're going to chat. I'm going to chat about the cruciate ligament. You will sometimes, in humans, it's referred to as the ACL, the anterior cruciate ligament. If you look into the Dr. Google and you are looking for something about dogs, then you will find cranial cruciate ligament. Either of those terms, they seem to be used particularly in the USA, but I refer to a cranial cruciate ligament. And it just has to do with the positioning. It's kind of like it's a medical description of the way in which the ligament lies in the knee. So just to recap, especially for those of you that didn't watch yesterday's video, the knee in dogs is the same as the knee in people. It lies here. Okay, so we have pelvis, hip, knee or stifle, ankle, foot. Okay, and remember, dogs walk on their toes, all right? And in the knee, we have, obviously, it's the femur. The large bone or the shin bone is the tibia. The bone on the outside is the fibula, okay? And those come together to form the knee joint. And then we have the kneecap or the patella on the top that lies in the groove of the femur or of the thigh bone. Hi, Jane. Welcome back. I must say, it's been really nice for me to see the regular names that come up and for you to all say hello. Like I said, I've got this enormous rehab facility and it's normally so busy. And now I have no one except a Dylan and a Shami to work on. And there's a limit to what my compromised dogs are able to do in a day. So anyway, and then moving on to, I've got a small model of the knee. So what I want you to see on this is, again, we've got the femur or the thigh bone, we've got the tibia, the shin bone. Inside, this is the joint capsule filled with joint fluid. Okay, there were my fingers coming out. We've got all these ligaments. We had the quadriceps muscle coming up from the top, coming into a ligament, which attaches onto the shin bone. Inside that ligament is the patella or the kneecap, okay? And inside the joint is the cruciate ligament. So I'm going to just take another model without the patella. And if you look at this, let me put it this side, I think. If you look inside the knee, that bit right there is the one part of the cruciate ligament. And if we turn the knee the other way, now you're at the back of the knee. There is the second part of the cruciate ligament, which is referred to as the caudal cruciate ligament. So inside the knee, the ligaments actually cross, and hence the Latin term cruciate, which means cross. Okay, so it's actually made up of two parts, and the function of this ligament is to stabilize the tibia or the shin bone in relation to the femur. So it attaches from the femur to the tibia, and if we think about, this is the femur, this is the tibia, and the ligament lies between the two bones. If the head of the dog is that way, every time the dog steps, there is a tendency for this bone to move forward. And it's the cruciate ligament that stops this forward thrust. Now, this thrust we will sometimes call tibial thrust. So the tibia is thrust forward with weight bearing. So if you think about where the kneecap is, okay, and the ligament that comes down onto the tibia, you can appreciate that the kneecap and that ligament also play a role in stabilizing the knee. Okay, so that's why I said yesterday, dogs with patella luxation have a greater risk of damaging the cruciate, because if that stabilization is not there, then there's more movement on this tibia and more strain on the cruciates, and therefore more tendency for it to tear. Now, there's been loads and loads of research. So the ACL in humans, the anterior cruciate ligaments, the same ligaments, just the anatomy is different. That is the ligament that is often torn in rugby incidents, squash players, snow skiers. So any of the movements that require rotation and twisting of the knee are going to also place extra strain on that ligament. So that brings us to, what happens in dogs. So because dogs walk with a bend in their knee, and a human walks more, when we weight bear, we have an upright knee. Dogs are predisposed to a damage of that cruciate ligament, okay, because there's the bend and because there's this movement forward. If you think about a straight leg, there's not the same movement forward as there is in a joint which is bent, like in a quadruped, okay, or like in dogs. So that ligament is constantly under strain. And in humans, the injury is usually traumatic. So like I've said, often associated with athletes. And they do something and the ligament tears, and then it's off to the physiotherapist. And if it's really bad, it's off to the surgeon. And in dogs, the traumatic incidence is very low. It does happen, so ball playing, let's catch the frisbee, let's jump up and land and leap and twist is placing a lot of strain on that joint. And I come back to hind limb awareness that we spoke about right at the very beginning. For dogs that perform in agility, for example, the more aware they are of those legs, when they're performing these high intensity athletic movements, the more likely it is that those legs are going to be placed in the correct position, therefore reducing the stress on the ligaments and tendons, okay? But it does increase the risk, all right? Anyway, I digress. In dogs, the disease is thought to be more of a chronic degenerative disease. So because there's all this strain on the ligament, the speculation is that every time there's extra strain, we get micro tears in the ligament. Hi, Angela. Nice to see you. We're going to refer to Phi in a little while, I think. Every time we have excess strain, there's a microscopic tear in that ligament. And every time the body repairs the ligament, the repair is less elastic than the natural ligament. And so if you think about a multitude of micro tears over time, over months, over years, eventually you're going to end up with a ligament. The original ligament can do this under stress. After all the micro tears and the fibrosis and the scarring, now you place that ligament under stress, and it can only stretch that far. And what happens when it can't stretch any further? It snaps. Okay, and it can snap while a dog is walking. It can snap when the dog decides to chase the hardy-dar. And it's not a traumatic injury as much as it is a degenerative process that has gone on for years, and now the strain is too much and the ligament can't cope and it tears. And so we get partial tears and we get complete ruptures of that ligament. Most of them will create a great deal of pain, and a lot of the dogs will become what we call non-weight bearing lame. So they won't put that leg down. In the more long-standing chronic injuries, those dogs will have an intermittent lameness, and then you'll take them for a run and they'll come back and they'll be sore. Sometimes the dogs actually hold their leg out. So if you look at them from behind, that injured leg is not underneath the body. The one that's good stays underneath the body, and the other one starts to come out. And that's a way of alleviating load on the stifle joint. And sometimes they can do something silly and they can be lame for 2 days, and then we give them some anti-inflammatories and then they're fine for a couple of weeks. In the meantime, there is an instability in that joint. Okay. And the instability means that the body is going to try to stabilize it. And it does that by laying down bone. So a lot of dogs with chronic, long-standing cruciate ligament injury, with or without surgery, will develop osteoarthritis in that joint. Okay. And I had a query yesterday from Tasha. She has a dog with a thickened stifle. He is 7 or 8, Weimaraner, and he shows the typical chronic pattern of cruciate ligament disease. And her question was, does he not have a patella luxation? So patella luxation is very easy to feel. Basically, we can dislocate that patella. So we are taught techniques that will allow us to dislocate the patella. So if the patella is healthy, it takes a tremendous amount of force to actually dislocate it. If it's unhealthy or there's a problem, then it's very easy to get it out of the groove. When we test for a cruciate ligament injury, there is a test. It's called a cranial draw test. Draw like in D-R-A-W-E-R, draw, as in movement. And it is best done under sedation or under anesthetic. Because if you think particularly with a large breed dog, if you think about the muscle size and the muscle strength, if they are awake and they are sore, they will work against us trying to do the test. So if they are sedated, then we can have the muscle relaxation and we're more likely to get a positive draw in the event that the injury is there. The absence of the injury does not mean that there is not a problem. Okay, but in most dogs that have a cruciate injury, we are able to elicit a positive response to this test. So if we look at the test, we've got our femur, our thigh muscle, and our thigh bone and our shin bone. And we will place our fingers, here's the kneecap, remember? We're going to place our fingers on those bones. So we're stabilizing the femur. Then we're going to place our other hand, the fingers, on the shin bone, on the tibia, and we're going to be stabilizing the tibia. Now we want to move this bone forward in relation to the femur. And what we do is we will move it. Okay. In a dog with a healthy cruciate, we get little to no movement, except if it's a young dog and it's developing, we do have some laxity in that joint. Okay. But in an adult dog, really we get next to no movement there. So if we get anything from 2 millimeters up to 1 centimeter of movement, we call it a positive cranial draw, and that is diagnostic for a cruciate ligament injury. Okay. We don't usually diagnose it on taking x-rays. We will diagnose it by doing that test. We will put the symptoms all fall into place, and then once we have the problem, the next question is, okay, what do we do about it? I see a lot of other people have come on board. Hello. Hi, Chelsea. Nice to see you. Okay. So what do we do about it? And there are so many options to treat cruciate ligament disease. And there are so many options because we don't have a perfect solution. And I really, really implore you, there is not an ideal way of treating cruciate ligament injury. Okay, this is not a genetic predisposition. This is a dog anatomical problem. Okay, so it's not as though we can go, well, they haven't found They haven't found a genetic component yet. In 10 years' time, science changes. The more research we do, 5 to 10 years, we might have found a genetic component. But where we stand right now, we don't have a genetic component. Magda, common in big dogs? No. It occurs large to small across the board because of the anatomy and because of the way the bones lie and because of the strain that ligament is under constantly. Okay, so there is no ideal way to treat or to manage cruciate ligament disease or injury in dogs. And so we have to have conversations, you have to have conversations with your vet in the event that your dog is diagnosed with cruciate ligament injury. So let me run you through a couple of scenarios. If we have, I see Chelsea's online, so if we have working dogs, if we have canine athletes, if we have dogs that require full use of all 4 legs at all times, the best way forward, what we want is we want that dog to be functional and to use that leg completely to the best of its ability as quickly as possible. And that usually means we go for surgery. Okay, surgery, pretty much depending on what surgery you do, if that dog is 3-legged lame, you do the surgery in 10 days, even less, the dog is going to be weight bearing. Whereas if you leave it, the dog is often stays non-weight bearing for a long time. And when it doesn't use the leg, we get loss of muscle. It is easier to retain muscle mass than it is to build up muscle after we've lost it. So for the dogs that have to have all their legs, man, we want to get them moving and working on that leg as quickly as possible. Does it mean that they can go after the surgery straight back to work or straight back to competing? No. We have to do a rehabilitation process, and we have to make sure, we have to allow time for the surgery, the surgical wound and site to heal. Okay, so that's one case scenario. The second case scenario would be you have a pet and he likes to go for walks and he plays around in the garden and now he has a cruciate injury. Chronic or not, what's the choice? The way that we are taught as vets, dogs over 15 kilograms require surgery. Dogs that weigh less than 15 kilograms, we can discuss. Do we do surgery or don't we do surgery? Now, having said that, I have treated a number of large dogs successfully without surgery. So I come back to, similar to what I said about the intervertebral disc disease and dogs with back issues, we have to investigate what kind of a dog is it? Are you able to keep it still after the surgery? Can you manage your dog? Do you work? What is your money? La, 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 la. I mean, there are so many variables that we need to look at. Okay, so your vet may well say you have a German Shepherd and it's injured, it's cruciate. The first thing the vet's going to say is your dog needs surgery. Okay, what I'm trying to come across to you, to get across to you, is that the more information you have and the more understanding you have and the more in touch you are with your dog and your own circumstances, hopefully we're all in touch with our own circumstances, the better decision you can make that suits you. So if we look at Angela has an 11-year-old German Shepherd. He is active. He's good for his age. He injured his cruciate and he was really sore. Angela, for her own reasons, prefers not to do surgery. And in many cases, we could argue the dogs 2 years after certain surgeries are no better off than if you waited and didn't do any surgery. That research is available as well. Okay, so it's a very, very, I wouldn't say it's controversial, but there are so many variables that I would urge you to do your research. Anyway, with Angela, we did prolotherapy. So that's a technique where we irritate the outside ligaments to get them to strengthen, to scar, so that we can get more stabilization. She also bought a custom-made brace. So I work in conjunction with an orthotist in Northcliffe, and you can find him online on Facebook on Animal Care Division. And he actually created a custom brace. So he makes a mold, So the brace helps to stop that movement. And in fact, we've had one made for one of Chelsea's dogs as well. And then we have to couple that stabilization and that fibrosis with physical rehabilitation. So then we have to go, okay, now how do we influence the scarring? Because the last thing we want now is a knee that becomes like a frozen shoulder and can't move because the scarring is excessive. Okay, so there's just so many things. Just in closing, I see I'm coming to the end of my time as well, but the important thing is do your research, know your dog, know your capabilities, know your financial capacity. Okay, if that dog has major surgery that's going to cost you 25,000 Rand and you can't keep it still, why are you investing that money? Okay, so the surgeries, just briefly, there's two main types that we now recommend in dogs. So in small dogs, we will recommend a stabilization suture. Okay, so we don't go into the joint usually. We go on the outside, and it can be called a lateral stabilization. It might be called a nylon band. It might be called a figure of 8 stabilization. And the idea is that we drill a hole in this bone and we drill a hole in this bone, and then we put fiber or nylon around. We put screws in and we put fiber or nylon around those screws. And the idea is that as that suture stabilizes, it stabilizes the knee it should stabilize it for 6 to 8 weeks so that we can get scarring and fibrosis around that knee. So we get a knee guard. The second type of surgery is the one where most of you will go to specialists, and it's the one they recommend usually in big dogs. We change the biomechanics and the joint angle of the knee. So this portion is often at such an angle that the femur keeps on wanting to fall off. So we cut this bone, and we move this top piece of the tibia into an angle which makes that thrust less. And we plate it usually. Sometimes we put a cage in. And the dogs are weight bearing pretty soon after the surgery. But remember that we have cut a bone, and a bone takes 6 to 8 weeks to heal. So you have to be careful after that for a period of time before you can let your dog be a hooligan. Okay, so same as with back surgeries, we didn't even discuss looking after your dog after surgery. We haven't even looked at any recommended exercises or anything that you can do for prevention. So let me ask you, please just pop me a comment on this feed today, tomorrow, over the weekend, and let me know if you want me to do another post following on from this one about can we prevent it, what can we do, a little bit more information maybe on the surgeries. And if there's enough of a response, I'll tackle it next week. In the meantime, Monday, I'm scheduled to talk about cannabis. So that should be really interesting. And so it's the buzzword. I will answer as many of your questions as possible on Monday. So thank you, everyone. Thanks for your time. Thanks for listening. And yeah, let's talk about it. I'm happy to answer your questions in another session. Have a tremendously enjoyable weekend. And if the sun shines, get out there and enjoy the sunshine, even if it is in a small garden. Thank you. Bless you. See you Monday.